Good morning, good morning, good morning. My name is Gregory Brunson. I serve as the Diversity Outreach Coordinator for the Memory and Aging Program. In partnership with the Office of Healthy Aging and in honor of Black History Month, we bring to you Black and Aging, Rhode Island's resources for Black seniors. Today's session, is part 2 of 3 sessions, which is caring for loved ones with dementia. For those who don't know, this year's theme for Black History Month is Black resistance. So please keep in mind that in context to today's topic, many of the questions will be in correlation to that theme. This morning, I have the pleasure of introducing my friend Jim Vincent, who will be our host today. He is the former NAACP Providence chapter president and a tireless community advocate. Jim, we thank you for all of the work that you do in our community, and we honor you this month as well. Thank you very much. And with that being said, I pass it to you, Jim.
Well, thank you very much for that, Greg. I really appreciate you and all the work that you do as well. And thank you to today's panelists. Today's panel will be about caring for loved ones with dementia. The goal of these discussions ought to be very educational for the viewers and helpful to the Black community. I'd like to thank the panelists for being on this hour. Let me set the table, though, with some stats. An estimated 6.5 million Americans aged 65 and older were living with Alzheimer's in 2022. African Americans are 2 to 3 times more likely to develop Alzheimer's. 20% of Americans with the disease are African Americans, and they bear 33% of its national cost. Only 35% of African Americans say that they are concerned about Alzheimer's or dementia. Nearly 1 in 4 African American adults are caregivers. And only 53% of Blacks believe that a cure for Alzheimer's will be distributed fairly without regard to race, color, or ethnicity. All right, with that said, I'm going to ask the panelists to introduce themselves. Why don't we start with Pastor Jenkins?
Thank you very much, Jim. Reverend Howard Jenkins, pastor of Bethel African Methodist Episcopal Church in the city of Providence, and also work very closely with Butler and Miriam Hospital in regards to Alzheimer and encouraging our BIPOC community, specifically our Black and Brown community, to be part of the U.S. Pointer Study. And thank you for being here with us.
Annie?
Oh, good morning. My name is Annie Murphy. I'm the program manager for the Alzheimer's Association Rhode Island chapter. We serve individuals throughout the state of Rhode Island who are supporting individuals living with Alzheimer's disease and all other dementias. Thank you.
Alert, audio now on mute.
Good morning. My name is Aletha Dickerson. I'm with the Rhode Island Office of Healthy Aging, network manager in our community living unit. And I oversee our Aging and Disability Resource Center contract, known as The Point, also our respite programs and our contract with the Alzheimer's Association Rhode Island chapter.
Thank each and every one of you once again for being part of this panel. This is going to be very informative and very interesting. Let's start by talking about dementia, and this is for anyone. What is dementia? Is Alzheimer's and dementia the same? Why don't we start with that? Open question.
I'll be happy to start this part of the conversation, Jim. It's really important that people do understand that there is a difference between Alzheimer's disease and dementia. And it's interesting that through our 24/7 helpline at the Alzheimer's Association, we get so many of these calls each and every day. So it's important to know that dementia is actually not a single disease. It's actually an overall term. It's sort of a group of symptoms. It does cover a wide range of specific medical conditions, and Alzheimer's disease is actually one of those specific medical conditions. Disorders that are grouped under this general term of dementia are actually caused by abnormal brain changes. Dementia is actually caused by damage to brain cells. And this damage actually interferes with the ability of our brain cells to actually be able to communicate with each other. And when these, brain cells get damaged, it actually causes these outward symptoms where we have problems with abnormality with how we communicate, our thinking skills, like being able to think, in short-term ways, memory changes, and just our ability to be able to function, in a rate as we may already do. So it impairs our daily life and it impairs our independence. And so Alzheimer's disease is actually the #1 cause of dementia. And it actually is a form of progressive dementia. And we, unfortunately, with Alzheimer's disease, we do not have a cure for this disease right now. It's a fatal disease, unfortunately. And Alzheimer's disease actually affects 60 to 80% of all cases of dementia. So, I mean, there are other causes of dementia. And we actually say that dementia is actually not a diagnosis. So that's important for people to understand, because we want to truly find out what's actually causing the dementia-like symptoms to be occurring. And we'll be kind of talking about that a little bit further.
Well, thank you for that very in-depth answer. And if either Althea or Pastor Jenkins would like to add, they can. And if not, I'll go to the next question.
You go to the next question.
All right, here's the next question. What are some of the early symptoms of dementia? How can you identify it in a person?
So, I guess I'll, start with that. It's what we need to recognize is that these early signs are when people begin to experience things that are making their daily life difficult. So it may be problems with short-term memory. It may be, having difficulty with solving problems that they've been able to, solve throughout their life already. Challenges with planning. So, you may be someone who, schedules, your son or your daughter's, sports activities, and now you're forgetting those dates and not remembering, that you actually, have to pick up your son. It's difficulty completing familiar tasks. So, you may have been, making a certain recipe or, a family meal on a regular basis, and now it's not coming out right. And, your family's noticing it just doesn't taste like it did. And now you're putting different ingredients in that recipe, and it's just not right. Confusion with time or place. So you may wake up in the morning and you think it's Tuesday, but it's actually Saturday. Or you think you're waking up that it's time to go to church, and church service is just not occurring that day. Trouble understanding visual images and spatial relationships. I like to describe this one as, you're walking down the street and you don't see the sidewalk and that you need to step down, and you trip over the sidewalk, or you're driving and you're driving too close to the sidewalk or to the median line, and that's, you're just not driving in a straight way. Or you may find someone, you're sitting at the breakfast table and you put down your coffee cup and it doesn't go on the table. It falls to the floor. That's changes where we're having difficulty with our spatial relationships.
Well, I have a question. On that. Would it be kind of similar to, it's not being able to find your keys, but it's not knowing why you look for the keys in the first place? Absolutely.
So misplacing things on a general basis, right? So, you might, family member or friend might find something strange in a wrong location. So when my mom first was diagnosed, when we first started, we would find my mother's cigarettes in the freezer, in strange places, losing things and not being able to retrace your steps and being able to find them.
Okay, Alethea or Pastor, you want to add anything to that?
Are you able to hear me?
Yes, we can hear you.
Okay. No, one thought that came to my mind, thank you, Annie, is that a close friend, when they first started seeing signs of his mother having Alzheimer's symptoms, she was having trouble identifying things. For instance, she thought that the remote control for the TV was the telephone. So I think you see that type of confusion, right, Annie?
Yeah, absolutely. And, think about, the use of, all these devices that we're using now, just all of a sudden not remembering how to use them. not being able to remember, passwords that you had, that you've known for many years, or not remembering, who a neighbor is or a family member, confusing them with someone else. Many times those are sort of some of the first signs of, concern.
If I could interject, for my father who has dementia, the final phase of dementia, it was interesting. He actually said, my response time and drive is not the same, and I need to stop driving. And I sort of scratched it, what are you talking about? But he was able to recognize and identify, which we didn't have a clue. But so sometimes it's not just the observer, sometimes it's the individual that recognizes there's some things that aren't clicking.
It's interesting that you say that, Pastor Jenkins, because, unfortunately, Alzheimer's disease affects people that are young. We know individuals who are in their 30s, 40s, and 50s who've been diagnosed with Alzheimer's disease or other forms of dementia. And many times in the medical community, they're not believed. And they really have to make a strong case for themselves that that something's wrong, that they're having problems with their spelling or their writing. Their language is being impaired. They're just not able to be as articulate as they used to be. So it's really important that when you're concerned about yourself or concerned about another individual, that you ask your your peers and your supports around you, are you seeing anything? So
okay, I'm going to go to the next question. If you think a loved one is experiencing signs of dementia, what can you do?
I think what's most important is be real with yourself. Take notice of any concerns that you have. Talk to the people around you that support you, family, friends. If you're involved in, your community, people that you trust, ask them, are you seeing anything? What are you noticing? And then it's important for you to seek, medical advice. Talk to your physician, talk to a medical provider that you trust, that you believe, knows something about these symptoms, and talk to them about it. One thing that people don't realize is that if you are a Medicare beneficiary, as part of your wellness visit every year, that you're supposed to have a cognitive screening. It's actually part of your medical insurance. And you need to advocate for yourself and say, hey, you know what? I know this is part of my medical history. I know this is part of my physical. I'd like for you to do, these kind of screenings on me.
And that's a very good point, because what happens is, as I experienced my father, and now my mother has the onset of Alzheimer's, it becomes obvious to me that there's a lot of things that the community in general just they don't know, and don't know how to ask those questions. And sometimes it's accepted, well, this is part of getting old, but in reality, it doesn't have to be that way. And there's a lot of resources out there that can potentially, I say potentially, slow down that process, or at least corral people around that can sort of help the individual as well as the family to be good supporters.
Audio.
Alethea?
Yeah, I just wanted to add too, during COVID, unfortunately, one of my close cousins was diagnosed with Alzheimer's. And although she had communicated by phone, family members hadn't seen her. And when they saw her, she had lost a tremendous amount of weight. They had noticed some confusion. So the first thing they did was help her to set up an appointment with her primary care physician. And then being in Massachusetts, they did connect with the Alzheimer's Association in that state. And that was a tremendous, tremendous help to the family.
And I think it's important too, to just clarify is that, there are underlying conditions that can cause dementia-like symptoms. And so, we don't need to be we need to be proactive in our own health, in our health, concerns with, family. Because there are things that may be causing these symptoms that can be reversible. An individual who may have maybe on multiple medications, there could be a interaction of medications and side effects that could be causing these dementia-like symptoms. An individual may be severely dehydrated or have an underlying, a urinary tract infection, for an example, that if treated, could clear up these symptoms. Severe, like I said, severe dehydration, vitamin deficiencies, but then other chronic medical conditions that can also cause these symptoms. For example, someone who's has diabetes and it's not well managed can have some of these symptoms. So, when we talk about that encouragement of talking to a medical professional, part of screening for dementia symptoms is trying to figure out what's causing it. And that's, there's a whole assessment process that an individual needs to go to so we can figure out what's actually causing it.
Okay, next question. What happens to the caregivers, family, adult children, relatives, sometimes friends? Seeing loved ones declining in health can wear you down. What's available for caregivers to get some sort of respite?
Audio now on mute.
Yeah, I want to jump in here and say, oftentimes, unpaid caregivers, family members who are taking care of their loved ones or even neighbors and other friends, they don't always realize, that they can get worn down. Their own health, physical and emotional health can, suffer. So, they need to ask some questions as to, how are they doing? And know that there are resources out in the community that can help caregivers. I can go on and on with our Aging and Disability Resource Center that I mentioned. People can call the point at area code 401-462-4444, and they can be connected to respite services that can help caregivers to give them some time, a break, so that they can have some time for themselves on a regular basis, or even in an emergency situation, should that caregiver need to be hospitalized or even take a small vacation. There are resources out there.
The reality is that family and the caregivers don't see it. Culturally, we're supposed to take care of family. And so as a result, you're all in. And so I saw that with my mom. I see that with my mom. I see that in myself. But what also has transpired is that family members and also friends are there as a support mechanism. And I think that becomes very important. I just flew back from Virginia. I just got in 2.5 hours ago. So I'm traveling back and forth. My daughter's there now, sort of pass the baton. But the thing about it is that it takes literally, here we go. It takes a village.
It does.
In regards to being able to be that support emotionally, physically. And so because I get frustrated. I get frustrated with my mom. I find myself getting frustrated with my father because I know my father's limitations, but my mom wants to push my father and say, Dad, they can't do that anymore. And so there's a sense of denial. So particularly when you see your parents going through it and you see their decline. And so it becomes very important that there's family and there's friends that are there to support. And that's really key.
I agree with you, Pastor Jenkins. And, I think part of it is understanding the disease and, how it affects the person living with the diagnosis, so that you can understand why they're acting and behaving the way they do. And by having that knowledge and that educational, knowledge can I'm not going to say it's going to take away, some of you say like your frustration and, but it gives you a baseline understanding of why they're doing what they're doing. But it's also, we need to find ways that, if we have those friend supports and our community supports, that they understand too, so that they can be a support to, you as the, primary, but so that, that the person living with the diagnosis feels that communal love by many individuals that's around them. And so, I believe that, this education and the support, we need to continue to provide that information so that the larger community can support that person. The Alzheimer's Association, we provide that education. We have all sorts of resources, whether it be coming into the community, coming to, a faith community to provide that education. We have support groups in person, as well as, virtually and, through chat features, that can provide that support so that caregivers can support one another in the community. There's something that's so valuable that you're in a space where you're talking to someone who understands what you're going through, and you can learn from one another. You can talk about those frustrating moments and how you can, what you can do, the opportunity of giving, tips and tricks to support that person. And I also think it's really, that we need to be able to allow that individual who's diagnosed to be able to remain in the community as much as they can be and be supported, because that's going to allow them to live well through the disease process. So that's important.
Well, thank you for that.
Yeah.
I'm now going to ask targeted questions to each of you. We'll start with Pastor Jenkins. Pastor Jenkins, the Black church has historically existed as a community staple in the resistance against racial oppression. In your opinion, what current barriers exist in Rhode Island for Black seniors to obtain adequate resources and information for Alzheimer's and/or dementia?
It's really the educational piece. There's a pathway, but here's the twist on this. It's not that the information is out there. People have to know where to find it. And so what really has to happen is that Alzheimer's has to come to the community. We can't go to Alzheimer's. And if we know that Alzheimer's is affecting over 30% of the African-American population, that means that Alzheimer's should be flooding our African-American community and introducing and having the general conversations. Annie has done several presentations for my church. The reality is that once that conversation starts, we have some ownership. The community has ownership to make sure we follow through. And so we have to make sure that we're establishing relationships. So it's a twofold. Are we resistant? For the lack of knowledge, we are resistant, and the lack of not knowing. But at the same time, we have to engage ourselves. I'm involved in U.S. Pointer, and we're trying to get our African-American community to understand the importance of being part of the data-driven collection part. But as we all know, science and African-Americans just don't go along. But what we have said on a continuum is that the Black church has a trusted voice. And so we're working to try to open that aperture so that folks are more receptive in understanding exactly what we're trying to do. We cannot be able to understand dementia in the African-American community if we don't have the data from African-Americans. We can't understand dementia in the Latino community if we don't have the data from the Latino community. And so it has to be simply stated as that, even with the hesitancy. But we have to engage and we have to understand. For U.S. Pointer, it's all about healthy eating and making sure that we exercise. Is that a factor that can slow down dementia or Alzheimer's? And so we have to begin to recognize and understand, one, Alzheimer's has to come to the community. And two, we have to listen in order to be receptive.
Well, certainly I applaud your work, Pastor Jenkins. I know, the Ministry Alliance has been on my television show at least 3 times to talk about the U.S. point of study. So thank you for being aggressive in terms of that outreach. Next question is to Aletha, I'm sorry. What does respite mean? Black History Month. Black History could be viewed as a month of respite. Could you speak to why respite is especially significant for Black caregivers?
Well, as I started to talk a little bit about respite before, I just want to say respite is a short break for someone to take some time for themselves. It's important in the Black community, in every community, for a primary caregiver, an unpaid caregiver, who's spending, a lot of time lovingly taking care of a family member or a friend, to be aware that they really need to be taken care of and looking at their own health, physical and emotional health. And a lot of times people are in denial, or they don't want to take time away from the person that they're caring for. So respite, that short break on a regular basis, to take a walk, even take a nap, go visit with friends, is very important to the health of the primary caregiver and others within that network.
Oh, thank you, Aletha. I'm going to go to Annie. Annie, I think you have described the difference between dementia and Alzheimer's and what causes Alzheimer's and the risk factors for Alzheimer's. I think you have.
We haven't talked about the risk factors.
Let's talk about risk factors.
Absolutely. So, there are risk factors associated with Alzheimer's, and, the number one risk factor is actually age. So as we age, after the age of 65, we actually increase our likelihood of developing Alzheimer's. And what we know is after the age of 85, there's 1 in 5 chance for someone living who are that age group of developing Alzheimer's disease. Family history. If you have a family history of the disease, your brother, your mother, your father, that increases your risk of developing Alzheimer's. There are genes associated with Alzheimer's, and although this only increases our risk of developing AD, there is what's called a deterministic gene that actually causes Alzheimer's disease, and that's less than 1% of all of Alzheimer's cases. And additionally, we do know that the Black and Hispanic communities and women actually have a much higher likelihood of developing Alzheimer's. Hispanics, twice as likely, Hispanics 1.5, and then women as well. And although we don't know exactly why these two communities have a higher risk, we do believe that it's the higher risk because of the predisposition, I'm not going to be able to say the word today, but to higher risk of having vascular disease, heart disease, and diabetes. So those are the risk factors, and it's interesting, some individuals, they are interested in learning if they have the genes associated with this disease. But that's a, really personal question and a personal pursuit. And they really should be talking to their medical provider if that's something that they're interested in doing.
I mean, Andy raises a very good point in regards to the vascular issue, but we also have to raise a very honest point. The disparity that is against African-American community and Latinos in regards to healthcare. Yeah. We talk to your primary care physician. I don't know the stats, but the stats are not that high for the African-American and the Latino community that have a primary care physician. Mm-hmm. And so this is a generational. This just didn't come up through COVID. It was highlighted during COVID. Mm-hmm. But the thing about it is that what has transpired throughout the generations has been the intentionality of not allowing African Americans, those of color, Latino community, to have access to proper health care. And so as a result, what is going on now, and this is just my opinion, what is going on now is that we're seeing this high rate of dementia, but the root cause is a lack of proper health care. And so once we're able to really begin to address the root cause, then we can sort of curb what is going on across our Black and brown communities.
Well, thank you, Pastor Jenkins. And I'm going to stick with you. Pastor Jenkins, can you explain to the listeners what the faith engagement model is?
So, what the faith engagement model is, as I said earlier, the church is considered a trusted voice. And so as a result, we lean on that with leverage in regards to communicating the importance of health, the importance of welfare, in this particular case, in the importance of the U.S. Pointer Study. The U.S. Pointer Study is broken up so that it's able to help gather data of what the causes are in regards to dementia. And as I stated before, for Dr. Lamont Williams is the architect of the faith engagement model, and he introduced this to myself and to those within the Ministers Alliance so that we could also help to stretch the message in regards to encouraging our particular communities, not just our churches, but our particular communities, our networks, and understanding the importance of being able to be part of this U.S. Pointer Study. So when we look at the faith engagement model, it's faith leaders engaging in their community, having the same consistent message in regards to what we're trying to do to curb and collect data that identifies the causes of dementia, potential causes of dementia.
Thank you, Pastor. I'm going to go to Aletha. Are there any local organizations offering some sort of respite care?
Audio now.
Yes, actually, there are, through the Office of Healthy Aging, we fund what is called the Care Breaks program. It's with the Catholic Diocese of Providence, Catholic Social Services, but it's open to everyone from all denominations. And within the Care Breaks program, it's a program which connects people with home care agencies, adult day, even nursing home for emergency care or assisted living, basically helping the caregivers to have some respite, especially with the adult day or home care agencies. So also part of our Care Breaks program, we're currently working with all of the nursing schools in our colleges and universities throughout Rhode Island. And we have nursing students who volunteer. They give their time, for free to work with families, to work with the caregivers, to go and spend time with folks who need someone to stay with them while their caregiver is having some respite time. So that Care Breaks program can be reached by calling the Point, our Aging and Disability Resource Center, which I mentioned earlier. The phone number is 401-462-4444.
Thank you, Aletha. Annie, back to you. Oftentimes, family members do not consider themselves as caregivers. In our culture, caregiving is just a way of life. We take care of our own without hesitation. Does the Alzheimer's Association offer any support groups, resources, trainings, or services to support caregivers?
I believe I know the question. I just want to make sure because it was a little broken up there for a second, but yes. So I think I mentioned earlier, we have, because we are an organization that actually is in every community here in the United States, we have chapters in every state in the country. And our chapter here is open for family members and people living, with the diagnosis to come in and they can come and use our lending library that we have there and all the resources that are available. Just to come in and actually speak to one of our care consultants, which I am one of the care consultants here in Rhode Island, just an opportunity to kind of talk about what you're experiencing, needing assistance with long-term and short-term care planning. We have a 24/7 helpline that is actually staffed by master level clinicians that any caregiver can use. If they're just needing someone to speak to that can truly understand what they're going through in that moment, we're available, and we're available in pretty much every language that's available that you can think of. So that 24/7 helpline is 1-800-272-3900. We also have, like I said earlier, support groups in our community. We have 17 support groups that meet both in person and virtual. Anybody can find when those support groups. You can call our helpline. You can go to the Community Resource Finder, which is a website that we oversee. But, I hear the word respite and I hear the word support. And, many times I find that our families really rely a lot of times on their natural supports. So that may be, someone in their face the community, a really good friend, or maybe your loved one is involved with some kind of, community organization where, you might want to, ask a friend or, a colleague to come and spend time with that individual so that the caregiver or the primary supports can get a little bit of time for themselves. I think so for so many people, we're having to sort of piece together the kind of support that they need from their, the community that they're within. Being able to just have your loved one go to the barber, or, go and, go out to a restaurant with a friend, is giving the caregiver some time to themselves. So, I think it's about piecing together what resources are available through our, our state agencies, but also using our, the people who are closest to our heart as, providing that kind of respite and support.
Audio now.
And Annie, if I can follow up on what Annie was just saying, I know, depending on the family and friends, I agree that's very, very important. And it brings to my mind, we have a Family Caregivers Alliance in Rhode Island. We now have a state plan to support caregivers. And within that, in trying to implement the plan, we have work groups. And we need participation from the Black community and other communities to hear how we can be inclusive and find out what is the best way to support the caregivers in the Black community. What is the best way to provide respite to the caregivers in the community? So if anyone is interested in joining, a work group with the Alliance, caregivers, service providers, faith-based organizations, please, reach out to us and let us know, because we would love to hear from you.
I think to that point, what agencies and organizations need to do is do a better job messaging.
Yes.
It's not that the resources are not there. It's not that there's support out there. Monies need to be put in. It needs to be on TV. It needs to be on internet. It needs to be on all facets of social media. It needs to be on Snapchat. It needs to be so much money invested in identifying, because what happens is that we say that we say we're looking, but the reality is the money that needs to be invested in messaging is not there. And that needs to improve. That needs to increase drastically, because that's how we're able to help, particularly our Black and brown communities. We need to be able to understand who is our neighbor and what is that media or medium that our neighbor uses to communicate. And so every community is different. Every ethnic community is different. And so the reality is that we just can't wait for that call to come. Right. We have to push that message to all communities and make sure that message is received or crafted so that that community is able to actually receive it in the manner which it's intended, and they're able to acknowledge that they can be a help, or help is available.
Yeah, and I have to agree strongly with that the messaging does need to get out there, what resources are available. When we're in a situation, we don't always know what resources are out there that could help us. We sometimes even don't know what we need in a certain situation. So stronger messaging, having some funding behind that would really, really be helpful.
And so, Jim, we talk about the theme for Black History Month being resistance. And I don't know if resistance is the right word. I know it's a nationwide theme, but it's about being intentional. It's about our European brothers and sisters being intentional and making sure that it is articulated, and it's not about being woke. That's the new thing that's going on now. It's not about being woke. We need to make sure that that same medium is out there that's in the white community. The same meetings out there for those that have much more money than we can ever imagine. And so that access is always the key. We saw it in COVID, and we see it in every aspect when it comes to medical issues that affect our Black and brown community.
I'm going to thank you, Pastor Jenkins, for that. It is 11:14. We're going to go to 11:20, and then we're going to ask for questions from the viewers. So I'm going to go back to you, Pastor Jenkins. You were recently interviewed for the War on Alzheimer's on with WPRI. Would you be willing to speak to how your relationship with the Memory and Aging program has impacted your experience as a Black caregiver?
Well, it goes back to what Aletha said. The more I know, the more I'm able to help. And so honestly, you know, we call it sometimers. We didn't call it Alzheimer's. And so the thing about it is that we have to educate ourselves and we have to be intentional. And myself working with Butler, myself working with Mary, working with Annie, it has helped me in regards to my frustrations, but also understanding what it takes. And it takes a village, it takes support, it takes subject matter experts like Annie, it takes subject matter experts like Greg and Tara and Lulu, that recruitment team that's out there trying to be in our communities. It takes a lot of different voices that come together. And so if it wasn't for those voices, it wasn't for people like Aletha, it wasn't people like Annie, it wasn't people like Greg, I would be taking all this on. But I'm comfortable talking about my frustrations. I'm comfortable saying that, you know, I'm all in regards to my parents, but that's my culture. And so when we look at the communities, that's probably the narrative that everyone is saying. That's my family. I'm going to take care of it. But here's the caveat. There are the Alethas out there. There's the Annies out there. There's the Butlers out there. There's a lot of different organizations out there to help. And we really got to push the envelope to make sure we're messaging so that people are not getting stressed out.
Well, thank you, Pastor. Next question is to Aletha. Aletha, systemic and historical discrimination from service providers deter Black caregivers from using formal services for training and respite care. What are some questions people should ask when seeking respite care?
Audio.
Well, people should ask, you know, if others know what resources are out there. People should ask, you know, how is my taking care of my loved one affecting my physical health? I know a lot of people who are caregivers have high rates of depression and anxiety. You know, it's a difficult job, even though it's a job of love. So they need to, you know, look inward, talk with their family members, their supports around them, and find out what are the resources. And again, there are resources there that can help.
Well, thank you, Aletha. Annie, where can someone find financial help for people living with Alzheimer's or their caregivers?
Well, I mean, I think we've touched upon some of the resources that are available now already. You know, there are, you know, availability through the Department of Human Services, the Office of Healthy Aging. There are programs that offer financial assistance for, you know, respite care, home care services, to, you know, minimize the costs that a person will have to come out of your pocket. You know, I think I think a lot of it comes back to is education. And, you know, if a family member is finding out that a loved one is diagnosed with a form of dementia or Alzheimer's disease, that you need to begin with early planning and early understanding. So that means, you know, understanding the types of services or types of supports an individual may need based on where they are in the journey of Alzheimer's disease, and what it may cost. And being intentional, which I really like Pastor Jenkins' word, but being intentional so that you understand what services are available, understanding what your health insurance covers and your medical insurance covers. I think that is absolutely key to, you know, being financially knowledgeable. There are also certain documents that someone should put in place, power of attorney, medical power of attorney. These types of documents are just, key pieces to the puzzle of supporting someone with this diagnosis.
Well, thank you, Annie. This might be the last question specifically, but I think we've talked about some of the health disparities that cause Black folks to develop at a higher rate than white folks, the disease. So Pastor Jenkins, outside of Sunday services, are there other resources the audience should know about Bethel AME?
Outside we're involved in a lot of different things. If you're talking specifically Bethel, we're involved in COVID. We're getting involved in cancer. With the Ministers Alliance has been proposed to get involved in cancer prevention to affect our Black and brown community. The Ministers Alliance has been intentional in making sure that we're trying to touch the bases in regards to what is affecting our communities. But here's the caveat. We as a community cannot be resistant. We as a community cannot be resistant of the help. Yes, we're going to question, but we also have to be open to learn and to be educated. It's not a one-way street. We recognize that we have a history. We recognize it's not a pretty history. It's a rather ugly history. But when you have community leaders that are out there trying to do the right thing, it becomes important that we take away the excuses and accept the help.
Well, thank you, Pastor, and thank you, panelists, for answering the specific questions from me. Now it's 11:20, and I'm going to open up the floor to the viewers and the listeners so that they can ask each of you questions. So I think I'm going to throw it to Greg.
Yes, thank you, everyone. There has been no questions, a couple comments coming through on Facebook. I know we have some viewers here through the Zoom as well. So feel free to provide any questions in the chat. We'll all be able to see them. But as of right now, we don't have any questions coming through. Thank you for such a rich conversation, everybody. I believe this was very, very informative and insightful. As the questions come in, I will be sure to ask them. But as of right now, we have no questions. So if you guys want to continue in this conversation, certainly.
Yeah, I want to ask a question of Aletha. Aletha, half of African Americans say that they have experienced discrimination while seeking care for a person living with Alzheimer's. In your opinion, what are some of the best practice services providers need to do to reestablish trust with Black caregivers?
Audio now on.
Thank you. I'm going to answer this question. Prior to working for the Office of Healthy Aging, and which was Elderly Affairs, I worked for Services for the Blind, Visually Impaired, providing direct service to older folks in their home. And I found that treating people as I would want to be treated and building trust, building a relationship really helps, service providers develop a relationship with families. That trust factor is very important. Yes, people have to be receptive to service, but service providers have to be conscious of treating people with respect and dignity, and in my opinion, as you would want to be treated yourself.
And that's a valid point, because one, you have to be, I'm gonna use this word again, Annie, you have to be intentional in knowing the cultures that are out there. And what has happened, we are quick to stereotype, and in that stereotype is normally negative. People assume what it is to be Black. Only Black people know what it is to be Black. And so it becomes important that people that don't look like us or look like me become better listeners and intentional listeners, and not reactive in taking bad information that they think they know or think they are smarter than we are. The reality is we understand our people, we understand our community, and so people need to listen to what is being said. So thank you for that, Aletha.
You're welcome. And to build on that too, what I found, even going within each household, you have a slightly different culture. So you need to get to know the people that you're serving and, build a relationship, because you gain their trust, and it's a two-way street, but it takes a little time.
And I just like to kind of jump in on this, and, this is really, kind of talking to our medical community, but, many times, and I hear this quite often, is that, our medical community are, they will give a diagnosis to to an individual, and it's pretty much, okay, you have dementia. I'll see you in 3 months, or whenever it might be. And I really believe that the medical community really needs to make sure that they're,
Alert.
providing that additional support to the individual that they're seeing in their practice, by, saying, here are opportunities for you to learn, here are resources that are available to you, because I think that's a step towards creating some trust with their patients, that, that they're here for them, not just, to provide, a diagnosis, but they're here to provide supports that are provided right in their community. That may be a step forward in creating some trust within the medical community.
Okay, I think there's a question, Greg.
Yes, thank you, Arthur. It says, how do you approach the difficult decision as to whether or not a person needs to be admitted into a residential treatment type of setting? I believe that was for anybody.
I'm gonna speak in regards to what I'm going through my parents. I am not putting my parents in a residential setting. I think it's a stress and strain on the family, but I think they do better in an environment that they're comfortable in. What I struggle with is quality of life. And that's a piece that families need to talk about early in the game. And that's another piece. We don't talk about this early enough. We need to talk about what happens when dad gets sick, what happens when mom gets sick, what happens when the brother or sister gets sick, what type of quality of life do they want? And we need to hear it at that time. And the question, Arthur, every family is going to give a different answer. That's just my answer. And some people just don't have enough hands to take care of an individual. And so that's the option, a residential treatment type setting. So my answer is going to be different. So you can talk to probably 4 different people. You might get 4 different answers. And so there's no right or wrong answer, I don't think.
Yeah, and I want to jump in here to say that there are resources out there to help people who want to stay or keep their loved ones in the community. There are long-term services and supports through the Department of Human Services. As I mentioned before, the point, they can provide person-centered options counseling for the person with the diagnosis, the medical diagnosis. But the counselors at the point can also provide option counseling for caregivers and family members to know what resources are out there that can help them to keep their loved one in the home.
Alert.
Arthur, here's something for you. And Annie touched on this in regards to making sure that within your will, you have the medical authorization to take care of folks. Here's a piece that always affects the Black and brown community. If you don't have the documentation that turns over deeds to a family member, what happens is that family loses a lot of property. And so that's a result that happens. And that's also a hesitancy why people don't resort to residential settings, because they don't want to lose that economic stability of that house. And so that's why it becomes important to have those conversations way early, and also do all those transactional legal things early. Ironically, my parents had transferred everything in my name 10 years ago. And why they did it, I said, I don't want this. It's not about what you want. It's about, we're going to get older. And so we had that conversation. So those are things you want to also take consideration as well.
And I'll just point too is that safety. I will just, kind of throw this in that, there are, concerns for safety for a person living in their home. And if that individual does not have, the support from family, outside, resources to support that person to live safely in their home and, at a a level of quality that there may be reasons that a person may have to transfer into assisted living or long-term health. There may be outside reasons that the family has no control over that may cause the result of having to go into, a long-term care facility. And again, I think all of us, have the intention that we want to stay home. But there are reasons that a person may not be able to live safely within their home. We have a wonderful resource on our website that people can turn to. It's actually at alz.org, safety. And there's all sorts of information in there regarding, how to safely equip your house for a person living with a diagnosis. A big concern is wandering for an individual living with Alzheimer's disease or other dementias. And there's a lot of learning that people need to have so that they can support that person to live safely and in the best quality of life that they can, so they can continue to live in their homes. So.
Okay, Greg, are there any other questions?
No other questions. Just
There's
another
another
comment.
question. There's another.
It just says, it's from Kim, it says, I just want to say that it was a very difficult decision. For me, it was myself that was a caregiver when the Sundowners started. I knew that it was time to make the decision. It hurt, but I had to train myself to see each day as a new day, no matter what, for my dad's sake. And Arthur says, thank you very much for your feedback.
You're welcome.
I thank you for that, because I too was a caregiver for both my parents. And, it is a hard decision that we make when we have to, when we make this decision that a loved one, needs to go into a community. And, for some caregivers, from family members, they find that it actually provides an opportunity for them to get back that role of being an adult daughter or adult child, when that occurs. I do want to throw out, just if it's okay with me, but we do here in Rhode Island actually offer a conference that's coming up pretty soon. It's the Alzheimer's Association's Rhode Island 12th Annual Caregivers Journey Conference. And that is taking place this year at the Crown Plaza in Warwick on Thursday, April 20th. It's a conference that is just for family caregivers and people living with the diagnosis to come and learn more about their caregiving roles, but also to visit resources that are available right here in our community for family caregivers. So just want people to be aware of that. And I do want to thank our sponsor, which is the Office of Healthy Aging, the Department of Health, and the Rhode Island Geriatric Education Center. So we hope that our registration will be open soon. It should be open up about the first week in March. And there'll be information out there how to register. So thank you for that.
Well, thank you. Greg?
Yeah, so that's it. We're at the 11:32 mark. Want to thank everybody for their time today. Pastor Jenkins, Aletha, Annie, this has been such a rich conversation. Really appreciate everybody. Jim did a great job hosting. Thank you everybody for their comments and their questions. And that is it. Once again, this was part 2 of part 3. Next week, same time, same place. We'll be finishing up with our final panel discussion, which will be mental health and developmental disabilities. Thank you all once again. We will share information in the comments regarding what was spoken about today. And we thank you, and everybody have a great day.
I too want to thank Aletha, Annie, and Pastor Jenkins. And I especially want to thank you, Greg, as well as Nicole Arias for all the work that you do.
Absolutely. Absolutely. Thank you. Thank you, everyone. Have a good day.
Thank everyone as well. Thank you.
Alert, audio now on.
Yeah, thank you all very much. Thank you.
Alert.